Hey there, welcome to my YouTube channel, or welcome back. I'm pharmacytechlove. I've created a series of videos designed to help you become a certified pharmacy technician. Throughout these paid courses, you'll learn everything from pharmacy math and drug names, including both brand and generics, to SIC codes, pharmacy laws, and the ins and outs of both retail and the hospital setting. I know many of you have shared concerns about not getting the right material in the classroom. That's exactly why these videos are here, to supplement your existing coursework. My content isn't meant to replace your live or online classes, but rather to be an extra resource. Maybe call this your little cheat sheet to success. While these videos are tailored for pharmacy technicians, they're also perfect for anyone in healthcare, meaning future pharmacists, doctors, nurses, phlebotomists, and more. And a quick tip, please be sure to take notes while you watch. Pause the video whenever you need to jot down key points so you don't miss anything. Let's dive in. Hey there, thanks for joining in today. Today we're going to walk through the retail pharmacy workflow, which is the backbone of pharmacy operations in community and retail settings. Understanding this process is essential for ensuring that medications are dispensed safely, accurately, and efficiently to our patients. This workflow consists of several interrelated steps and involves different pharmacy roles, primarily the pharmacists, pharmacy technicians, and sometimes the pharmacy clerk or interns. Let's begin with learning the first phase. Hey, welcome to prescription intake. Okay, anywho, this is the starting point of the entire workflow. Prescriptions can come from a few different sources. So if you don't know, girl, you need to check in, clock it. Let's get into it. First, let's talk about e-prescriptions. They are the most common today. These are sent electronically. That's why they're called e-prescriptions. So these are sent electronically from a prescriber's office, typically through systems like SureScripts. Then you have handwritten prescriptions, though increasingly rare, may still be brought in by some patients. Okay, let's continue. Let's get into it, girl. So then you have phone-in prescriptions. So first we talked about e-prescriptions, handwritten prescriptions. Now we're on phone-in prescriptions. Now these are usually for non-controlled substances and are taken by the pharmacist directly from the prescriber or the doctor. Prescriber and doctor, same thing. Yeah, got it. Or their authorized agent. Okay, so boom. Then we have refill requests. These can be initiated by the patient, a pharmacy's automatic refill program, or staff who contact the prescriber on behalf of the patient. All right. So at this stage, it's critical to perform an initial review for legality. The prescription must contain, friend, it must have the patient's name, date, drug name, and strength, the dosage instructions, quantity, refills, and the prescriber's information. Okay, so for controlled substances, there's additionally scrutiny, because they're controlled narcotics. But anywho, the pharmacist must verify the DEA number, look for red flags, and evaluate the overall legitimacy of that prescription. So whenever a patient comes in and they're picking up a controlled narcotic, please make sure you gather their ID. Bye. Thank you so much, Brandy. You did an excellent job covering prescription intake. All right, we are now going to move on into data entry and patient profiling. Well, hi there, darling, and welcome to data entry and patient profiling. The next step is typically handled by the pharmacy technician. The technician enters the prescription details into a pharmacy management system like Pioneer RX, QS/1, honey, and RX30. They'll also verify and update the patient's demographics, insurance information, allergies, existing medical conditions, and last, honey, is medical history. Now, a critical part, darling, in this process is selecting the correct national drug code. That's normally called the NDC. Again, that is National Drug Code. This ensures that the specific products, dosage form, and manufacturers are accurately identified. Now, during this phase, the prescription is also submitted to the patient's pharmacy benefit manager, or it's called PBM, Pharmacy Benefit Manager. This is also known as insurance adjudication. It's just basically, sweetheart, it's just basically processing a claim. Okay, now common issues the technicians sometimes face that need to be resolved includes prior authorizations, drugs not covered by the plan, refill too soon rejections, and plan exclusions. So let's talk about that for just a moment here, darling. Now, prior authorizations normally have to be done by the doctor's office, okay? The best we can do on it, honey, is call the doctor's office and let them know that the prescription needs a prior authorization. Basically, the insurance company wants to make sure that the medication is medically necessary. You know what I mean. Okay, next, drugs not covered by the plan. Now, you have a formulary and you have a non-formulary. The formulary is a list of medications that are covered, honey. The non-formulary list are the drugs that are not covered. If it says that the medication is not covered, it is on the non-formulary list. Now, refill too soon is kind of self-explanatory. If they've only had the medication for 10 days and it's a 30-day supply, darling, you've only had it for 10 days and it's supposed to last 30 days? That is refill too soon. You have to at least use 75% of that medication, which is about 25 tablets. Okay, honey? And then we have plan exclusions. Remember I talked about that one? This is if a certain medication is not included on your plan. Okay? All right. They may also apply manufacturer coupons. Don't forget about that, and don't forget to tell your patients there are coupons online. Okay? Also, discount cards. Well, honey, listen, I have heard that most pharmacies have been being charged for using those pharmacy coupons. Those pharmacy discount cards. So I'm just not for sure on that. You may ask your supervisor. All right, y'all. Hey, Pharmacy Tech Love here. I just wanted to come on and discuss this next one with you myself. This one is Drug Utilization Review. The acronym for this is DUR, and it's basically, a clinical check. So this phase is the pharmacist's responsibility. This is not the responsibility of the technician. However, it is the duty of the pharmacy technician to let the pharmacist know that a DUR needs attention. The DUR is a vital safety check. The pharmacist reviews for potential drug interactions because we don't want the patient to take something that they're possibly allergic to, or they could be possibly taking two medications that may conflict with each other. Then there's duplicate therapies. The patient may be picking up a medication that they've already picked up the same medication from a different pharmacy. So we don't want the patient to have duplicate therapies, meaning the same medication. Then also patient allergies. When I worked in retail pharmacy, every time a patient picked up a prescription, every time a patient dropped a prescription off, I did ask them, did they have any new drug allergies that they wanted us to be aware of? The second to last is dosage accuracy. If the medication says 5 milligrams, we do not need to give the patient 50 milligrams or 500 milligrams, okay? We need to make sure that the dosage is accurate. Also, we have clinical appropriateness for the condition if known. If the medication is a controlled substance, the pharmacist will also consult the PDMP. Again, PDMP. That is the Prescription Drug Monitoring Program to track usage history and monitor the overuse or abuse of certain medications, normally controlled substances. They'll also check, the PDMP will also check how frequently the patient is refilling the prescriptions, particularly for narcotics. Okay, let's check in with another technician with prescription preparation, which is filling the prescription. Hi, great day to talk about prescription preparation. So basically, prescription preparation is just filling the prescription. Once the prescription has passed the clinical review, the technician prepares the medication. Now, this may involve counting tablets and capsules, measuring liquids, reconstituting powders into a suspension. If you're not familiar with that, most medications for children come as a powdered form, and we have to reconstitute it, meaning add water to the powder, in order for it to become a liquid suspension. Or it could be a solution, but we'll talk about the difference in those at a later time. So they must also, meaning the prescription, they must also label the prescription vial with both the patient's specific label and necessary auxiliary labels, such as take with food or may cause drowsiness. Completed prescriptions are then organized by patient and stored in designated will call bins or pickup areas. I want to talk to you about something that we just previously discussed, and I will list all 3 of those once more. The first one is counting tablets or capsules. So when you count those off on your tray, you will have a spatula that you use in your hand. You're going to flip open the lid that will be to the left. That's where your capsules are. That's where you're going to scrape your capsules or tablets into that designated area. My little tidbit to you is try to count your capsules or tablets in 5s, meaning as 5, 10, 15, 20, and so forth. Now, let's talk about measuring liquids. When it comes to measuring liquids, it is so important to know that everything that you do in pharmacy will eventually be turned to milliliters. Well, let me not say turned, but more converted. So if you have 30 milliliters, that is going to be 1 fluid ounce. So if you have 8 ounces, you multiply the 8 times the 30 milliliters, and that will give you 240 milliliters. But if you do not understand this as of now,
please wait for the math videos because they are coming. Now, the last one that we did discuss, reconstituting powders into a suspension. The most important thing is to not let the patient go home with the powder, because they're going to call back and say, hey, what am I supposed to do with this powder? And then they're going to have to come back. The patient is going to have to come back into the pharmacy, and we are going to have to add the distilled water into that refabricated powder. But the most important thing is we don't want the parent to have to come back. They already have a sick child at home. All right, you guys take care, and I'll see you in the next one.
You are halfway through this video. Our next section will be discussed by pharmacists. The next one is final verification. Then we have patient consultation, payment and delivery, and then we may discuss some follow-up and maintenance tasks. But the next two, final verification and patient consultation, I will let you speak with a pharmacist on that. All right, I'll let you guys watch the next video. I'll see you in a few in my office. Hello, how is everyone today? So I have you, and we will be discussing the final verification and patient consultation. Now, before any medications are given to a patient, the pharmacist must perform a final verification. They will confirm, meaning the pharmacist will confirm the correct medication, strength, quantity, and NDC number. Remember, NDC means National Drug Code. The pharmacist will also confirm that the directions match what the prescriber has ordered, that the patient and prescriber details are accurate, and that there are no entry errors or clinical concerns. Once everything checks out, the pharmacist signs off either electronically or physically, and that is how we perform our final verification. Let's talk about patient consultation. The pharmacist consultation is required in certain situations. When a patient receives a new prescription, when there's a change to an existing therapy, or when the patient requests it. During the consultation, the pharmacist explains the name and purpose of the medication, how and when to take it, possible side effects, what to do if a dose is missed, or how to store the medication. Pharmacists are encouraged to use open-ended questions to assess patient understanding. They'll also provide printed medication guides in the patient's preferred language when possible. Hey girl, you're back. Pharmacytechlove wanted me to come in and talk to you guys about payment and delivery. So next is the point of sale process. It is when a clerk or a technician typically collects payment or co-payment, ensures signatures are obtained. Make sure you please get those on controlled narcotics. And if you are working with controlled narcotics that are coming in for delivery, make sure your pharmacist is there to verify whatever is coming into your pharmacy. That's a controlled narcotic. Okay, moving on. Ensures signatures are obtained for HIPAA compliance and controlled substances. If you don't know what the acronym HIPAA stands for, it means Health Insurance Portability and Accountability Act. Okay, let's move on. So the clerk or the technician also typically hands the medication, of course, to the patient, answers general but non-clinical questions. Patients today have multiple delivery options. They can either pick up their medications in-store, drive-through, curbside delivery, or home delivery via courier or mail. It is so easy now to get our prescriptions. We always need to make sure we are putting our patients first. I know sometimes we like to, talk at work, but please remember, our patients are number one and they come first. Hey there, darling. I was asked by Pharmacytechlove to come back in and check on y'all. Okay, so we do have a topic that we have to speak about now. So this is follow-up and maintenance tasks. So pharmacists don't stop working once the prescription is picked up. Ongoing prescriptions include, now listen to me, darling, there's refill management, which is proactive reminders or auto-fill programs, or auto-refill programs. You have inventory management, which is restocking low supplies, removing expired items. Then you have returns and disposals, which is handling recalls and expired medications according to the DEA and local rules. We also have, darling, pharmacovigilance, which is reporting adverse reactions to MedWatch, or to the FDA. Okay, so now I want you to think about it like this, darling. Now, a side effect is just something that's going to normally happen when a patient takes the medication, like Benadryl. So, say for instance, you took Benadryl and you have gotten sleepy. That is a side effect. Okay, all right, darling? Now, an adverse effect is an unwanted or unintended effect. So, if you were to take Benadryl, darling, and your throat closed all the way up, now that's an adverse effect. That is not a side effect, darling. And last, we have documentation for insurance claims, legal compliance, and audit readiness. All right, I think that's all I have for you. Hopefully, I can see you soon. Take care. Hey there, just one more thing that I would like to add coming from a pharmacist. Let's discuss compliance and regulations. So, finally, the pharmacy must always operate within the bounds of law and regulations. That includes state pharmacy board rules, DEA guidelines for controlled substances, HIPAA standards for patient privacy. Then we have OSHA standards for workplace safety. Pharmacies are routinely audited, so proper training and documentation are essential for compliance. And later within the videos, we will learn what OSHA is, what HIPAA is, and also who the DEA is. So stay tuned, and I'll see you soon. You've met some wonderful technicians today and also a wonderful pharmacist. We are now going to go into our quiz portion. Good luck. If you feel like you don't know the answers, go back through, watch the video, and take notes. The first question states, what's the most common prescriptions that are received today? Is it going to be handwritten, e-prescription, phone call, or fax? The answer is e-prescriptions. Most prescriptions now come electronically, improving safety and accuracy. Okay, let's move on to number 2. Which of the following must be verified during prescription intake? So remember, the key word is intake. That means you're taking in a prescription from a patient. That can also be off of the fax machine. Okay, which of the following must be verified during prescription intake? Should we take the patient's credit score, the DEA number for controlled substances, and DEA represents the Drug Enforcement Agency? Should we gather the patient's birth certificate and also pharmacy hours? Which answer do you think is correct? If you answered B, DEA number, that is absolutely correct. Especially important for controlled substances to ensure legality. Okay, let's move into problem number 3. What is the purpose of the DUR? And remember, DUR represents Drug Utilization Review. So is this DUR used to speed up the filling process, to verify insurance coverage, to catch potential drug-related problems, or to print patient labels? The answer is C, to catch potential drug-related problems. The DUR checks for interactions, allergies, and therapy duplications. Okay, who performs the final check before the medication is dispensed? Is that going to be the pharmacy technician, the pharmacy intern, the pharmacist, or the delivery driver? The answer is C, the pharmacist. Only the pharmacist is authorized to verify prescriptions before dispensing. What is an NDC used for? Scheduling appointments, counting tablets, identifying medications, or scanning insurance cards? If you chose the answer C, that is absolutely correct. Identifying medications. The NDC, or the National Drug Code, identifies the drug's strength and packaging. Which of the following would likely cause a claim rejection? Giving a flu shot, refill requested too early, counseling a patient, or labeling a prescription? The answer is B, refill requested too early. Insurance companies track refill timing to prevent overuse. When is patient consultation required? Is it only if the patient pays in cash for every prescription, only when giving vaccines, or for new prescriptions or changes? The answer is D, for new prescriptions or changes. It is also required if the patient asks. What is PDMP used for? Is it going to be used for measuring blood pressure, tracking controlled substance use, delivering medication, printing labels? The answer is B, tracking controlled substance use. Pharmacists use it to monitor misuse and doctor shopping. What service might a modern pharmacy offer in addition to dispensing meds? Plumbing repair, oil changes, blood pressure checks, or car washes? The answer is blood pressure checks. Pharmacies often offer basic health screenings. Who oversees compliance with HIPAA and DEA rules in the pharmacy? The janitor, the pharmacy software company, the pharmacist and pharmacy management, or the delivery drivers? The answer is C, the pharmacist and pharmacy management. They're responsible for ensuring the pharmacy operates legally and safely. I want to thank everyone for watching the videos. Please comment, like, and subscribe, and I'll see you in the next one.